let her know. So I'm gonna give you 3 different consents. I'm gonna do the consent for the filler. It's gonna go ahead and walk you through procedures, some risk. Could be swelling, redness, bruising, tenderness of the area. Then we're gonna go ahead and have your Botox consent. Please make sure you read everything. And then we're gonna go ahead and have you initial. There's gonna be a second page to it, which we're gonna need your initial at the top. This is important to mention to the patients. Most patients will just initial here, go down here and just sign. They forget this initial.
Or forget to turn the pages at all.
So you want to let them know that it's a 2-page. And the final one will be your photo consent. You let them know again what we know from the photo consent. Go ahead and give them a couple minutes. I would step out while they go ahead and fill it. Once the patient has filled it out, I go ahead and can grab them from the patient. While I do this, I make sure they filled everything out. So when they have more than one consent, or when they have the Botox one, I always go through every single page. When it's only one consent and one page, it's easy to see. But here, as I'm walking back, I'll make sure that they initial everywhere. If they forgot anything, I'll be like, oh, those are we missed an initial here. Do you mind initially reading and initialing that?
Do you ever, after the price quote, do you ever start numbing them and then let them read the consent while they're numbing?
It depends. So for lasers, I do. I numb them. I do photos and numbing, and then they do that. For fillers, I don't. Necessarily, but sometimes depends if we're super busy. So it goes back to time efficiency and being able to have the time management. So let's say that you have 2 patients and one of them is gonna do Botox and then the other one's gonna do beading. They both require 20-minute numbing. Botox can be 15 minutes. So you wanna make sure that that patient is making that decision, who's gonna go first, right? So your Botox is gonna be done quicker. If you do pictures, you numb them, and then you consent them. That way, while they're consenting and numbing, you go get your patient's photos taken, you numb them, then you consent them. That way, they're not ready at the exact time, rather than you were to do photos, consent, do photos, walk out, consent, do photos, numb, and then numb your other patient, because then they're gonna be ready at the same time. So it's just that time management and being able to make that decision. So, consent, numb your patient. Depends where the patient's getting the fillers and the Botox done. So we know that she's gonna get done forehead and glabella. So we need to numb this, and we need to numb this. The more you work with the fillers, you will know what Dr. Kormeili uses them for. If you're ever not sure, you would want to double check with Dr. Kormeili. So you would let her know, Dr. Kormeili, where are you going to be putting the filler? So, and then you would ask her that when she's letting you know what filler she wants for the patient. Okay, so in this case, we'll go ahead and ask her, what fillers would you want me to use, Dr. Kormeili?
Well, let's do refine and let's do a cheek and jawline augmentation.
Perfect. So she said,
and we'll put a little bit in the chin.
Cheek, jawline, chin. So what we need to numb, it's got to be comfortable to me. Okay, so she said cheeks. So doctor will inject here for the cheeks. So we numb both sides. Jawline, right here. The other side, and then the chin. Sorry, you're ticklish? I'm sorry, it'll be right here. Okay? I'm super ticklish. So that's what we would numb. Okay? We will numb her forehead, right here, the cheeks, jawline, and then the chin. If the doctor also said nasolabial folds, we would do this area right here.
In general, it's easy to numb from here to here and from here to here because the saran wrap kind of covers it, sorry. And then the chin, you have to make sure that you cover this whole area. When we do lips, you want to make sure that you do the vermilion border, which is, let me get a Q-tip. We want to do this where you put a lip liner, but you also want to put where you put a lipstick because we are going to put fillers both around the lips and inside the lips. So we want to make sure that area is numb. Always tell the patient not to do that. As soon as they start licking their lips, they're going to get the numbing cream in their mouth. And then they get it on their palate, and then they start feeling numb, and they think that they're choking, or it's a very uncomfortable feeling. So you want to make them very mindful, like, I'm putting it on you, like, don't talk, don't eat, don't drink, don't basically lick your lips until we wipe off the numbing cream completely. And when we wipe it, we want to make sure we ask them to open their mouth. And you want to open your mouth for me, please. And you want to wipe it out, not push it in when you're wiping. Okay. The other area that sometimes we numb is this bunny line. So you want to kind of do the dorsum of the nose, exactly. Or crow's feet. You want to do this whole area, but we put a little smidge right here because we get it right under the eye muscle. From when we do the neck, you want to go all underneath here, because she doesn't have any, but like sometimes people have prominent neck muscles. We want to get that. Sometimes we do just the masseters, which are these big muscles for chewing. So you just do the lower face. And then if we said like earlobes or anything else, we can definitely do it. So if you're ever in doubt, just ask me and I'll show you.
Sometimes the doctor will also do like smoker lines, which would be like right here as well. So
Good
we can
point.
always numb those out. Sometimes, like, we call them smoker lines, and then if we're numbing them, people will be like, I don't smoke. It usually happens with straws too, because you're doing that motion to create those fine lines in there. But we usually will numb that too.
An area that I almost always put it and people don't really think about is here, this corners of the mouth. As we get older, I mean, she's so young, but you can get like a descent because you have so much volume loss. So you want to make sure they're numb all around this little soft triangle and a little bit around the mouth. Sorry.